On efforts to fight the outbreak like blood transfusions, I spoke to Dr. Peter Hotez from the Baylor College of Medicine in Texas. He serves as Dean for the National School of Tropical Medicine.
Well, unfortunately, we do not have a MERS coronavirus vaccine yet. We should have one, but we don't have one ready to go. And this is the second time we've seen this now. We did not have a vaccine ready for Ebola. We don't have a vaccine ready for MERS coronavirus. So we're left trying to pick up the pieces and salvaging what we can do, which is, we know there's a very old-fashioned approach, which is those who have survived certain virus infections produce neutralizing antibody that's present in their blood or their serum, and we simply collect their blood or serum and administer it to people who we know are at risk of developing severe infection.
I want to ask you about the lack of a vaccine. As you mentioned, the first outbreak of MERS was 3 years ago. Why hasn't there been any kind of substantial development in terms of a vaccine? You also mentioned Ebola. Do you think generally the world is unprepared?
The world is definitely unprepared. We have a problem in that the business model is broken. The business model says that we wait for a crisis and then we try to persuade the major pharmaceutical companies to start developing the vaccines. And by the time the vaccines are ready, the epidemic or outbreak is over. We saw this with Ebola virus, and now we're again in a similar situation with the MERS coronavirus infection. What we need is a new system in place. We have an over-reliance on the major pharmaceutical companies. These are vaccines for which the commercial market is not very lucrative, so we have a market failure problem. We need another set of actors involved. We're one of those types of actors. I head an organization known as the Sabin Vaccine Institute, which is a nonprofit product development partnership that makes vaccines. We need to bring product development partnerships into play. We need to bring more vaccine manufacturers from disease endemic countries into play, because otherwise we're going to face this situation over and over again.
Well, and speaking of other actors, the United States and China have been working together. They developed a MERS antibiotic. The trial results have been pretty favorable so far. Do you think it's common for countries to work together in developing new vaccines and medicines, and should they do this more often?
Absolutely. In fact, we even have a name for this. We call it vaccine diplomacy, which is something that at our Sabin Vaccine Institute and Baylor College of Medicine is something we're trying to do. We think how we make the vaccine is as important as what we make. Look, China is the world's largest producer of vaccines. They're producing an estimated 5 billion doses of vaccines every year. But most of those vaccines are not new vaccines. They're old or well-tested manufacturing processes. China could do a lot better in terms of innovation for new vaccines, and I think partnering with institutions in the United States would be a way to go.